6:26 is the time. Welcome back and good morning to you. It happens to a lot of people as we get older, and our pets do as well. As the pets become older and some develop problems with their hips, we're going to talk about that. We've invited Dr. Anthony Kramer in from the Chicago Veterinary Medical Association to talk about what's called hip dysplasia in your pet and what you can do about it to help the pet. And good morning to you. Thanks for coming in. We appreciate it.
Thanks.
So hip dysplasia, is that known as a bad hip, a stiff hip? What would be layman's terms for that?
It's a genetic disease that just a malformation, or it is a bad hip, and one that can start in very young dogs and cause them a lot of discomfort.
So is it more common in the young dogs or in the old dogs, you think?
It can develop any time. It's more common in large to giant-sized dogs.
So right here you have a model of a dog's hip. Can you tell me what happens when you get hip dysplasia?
Well, basically, I don't know if they can see this. This is a normal side hip, much smaller. Over here, we have a hip that has a lot of degenerative changes, a lot of bumps and arthritis there, and obviously that's going to grind a lot more than a nice, smooth, normal hip.
So what happens? Do they lose the soft tissue? What happens to make that form?
Well, basically it's a loose hip, and because it bangs around and the bone grinds on bone, it causes these little arthritic bumps to form, trying to stabilize things, but it really can't stabilize it, and they get stiff and have less range of motion.
So let's talk a little bit about the symptoms that obviously you can't see inside your dog's hip. So what would you see? You say it's a little bit of stiffness in the hip.
Sure, slow to get up. Many times these dogs will just have an abnormal gait, and
in the morning, more or less?
Most often after they've been resting and they get up, and just like people with arthritis, many times we're seeing the same signs in the dogs.
So kind of slow as they're getting up then as well?
Exactly.
Okay. Also, for the dogs that are getting older and they show this, you said that they don't exercise as vigorously as they used to. So they're running around out in the yard not as well as they used to?
Yeah, you usually see a dog maybe who's 3 or 4 years old who's acting like a dog that would be much older.
Would you notice a change in their stride as they're going as well?
Usually you can kind of notice almost a bunny hop gait, where instead of using the legs individually, they're using both at the same time to minimize the discomfort.
Oh, really? So the bunny hop, you said? Mm-hmm. Bunny hop gait. They try to sit down as well?
Usually they won't stay on the legs very long if they're hurting them.
Okay, and so why would they be so reluctant to stand on the hind legs? Just because it is so painful for them?
Exactly.
And it's very stiff. So what happens as far as the hip replacement surgery? Well, what should an owner expect? It sounds so major.
Well, it is. I mean, many years ago, I guess not even too long ago, there was pretty much a death sentence associated with hip dysplasia. And nowadays the surgery can be done, and just like in people, put these dogs back to full function.
All right. Doctor, thank you so much for being here.
No problem.
Folks at home, if you have questions, there is a number you can call. The Chicago Veterinary Medical Association is 630-325-1231. Anthony Kramer, thank you again.
You're welcome.
And Lisa, back to you.
All right. Thank you, Robin. We're almost at 6:30 right now. Coming up in our next half hour for you, news that 2 of the students killed in that Texas A&M bomb